Let's revise acromegaly. First, let us see a question which is asked in NEET PG 2022. A 30-year-old male presented with complaint of teeth gap widening, frontal bone thinning, and foot-hand enlargement. These are the features of 30-year-old male. What is the diagnosis, screening test, and how do you treat this? Okay. Let's understand teeth gap widening, frontal bone thickening, and foot-hand enlargement. These are nothing but muscle and bone growth. Okay. So, muscle and bone growth occurs due to increased release of growth hormone. 30-year-old male, that means his epiphyseal plates are already closed. So, if growth hormone is excessively released, this will cause acromegaly. Okay, let's understand the physiology, what happens here. How growth hormone is secreted? See, first through hypothalamus, growth hormone releasing hormone is secreted, which acts an anterior pituitary. It releases growth hormone in response to growth hormone releasing hormone. This growth hormone acts on the liver. An intermediate is produced. This is called insulin-like growth factor 1. This acts on bones and muscles and is responsible for normal growth. This is all normal physiology. I am talking about the normal level of growth hormone that is secreted. Now, some pathology in the hypothalamus or in the anterior pituitary or somewhere else that is responsible for excessive production of growth hormone. Increased production of growth hormone. If the patient is less than 15 to 18 years, then epiphyseal plates are not closed, so long bones will be increased in size. That may result in gigantism in less than 15 years. But in more than 15 to 18 years, their epiphyseal plates of the bones are closed. So, it may result in muscle and bone thickening. So, what happens here is, given the question is 30-year-old male, so in him it causes acromegaly. So, excessive growth hormone. If there is excessive growth hormone, even IGF-1 will be increased, and then there will be excessive action on the bones and muscles, causing excessive growth, results in acromegaly. So, we will see the symptoms. Symptoms you can see: coarse facial appearance, spade-like hands, increase in shoes, large tongue, prognathism. There is increase in interdental space, excessive sweating because the sweat glands also increase in size over the skin. Then features of, if pituitary tumor is responsible for this, then there will be signs of headaches and bitemporal hemianopia is very, very important. You have to remember, for any pituitary macroadenoma, if there is a visual disturbance, then that is bitemporal hemianopia. This is another MCQ. So, what are the complications of acromegaly? Because of the increase in size, the complications are hypertension, diabetes, cardiomyopathy, and colorectal cancer. Okay. So, what is the screening test and what is the definitive test? Screening test is nothing but IGF-1 level. We have already discussed that due to increase in growth hormone, IGF-1 level also increases. So, that we will take as screening test. What is the confirmatory test? In endocrinology, confirmatory tests are always stimulatory or inhibitory tests. If there is increase in the growth hormone, then we will try to inhibit it. So, oral glucose tolerance test we will give. In normal people, if we give oral glucose load, then growth hormone will be suppressed. But in acromegaly, even after oral glucose challenge, growth hormone will remain high. This is the confirmatory investigation, glucose challenge test or oral glucose tolerance test. Okay, how do you treat this? Treatment is always surgery. Treatment is always surgery in case of acromegaly. That is, transpenoidal resection of pituitary growth. Transpenoidal resection of pituitary growth is the first line management. If the patient is not fit for surgery or after surgery, we will treat with adjuvant medical management. First line medical management is somatostatin analogues. Those are octreotide, lanreotide and pasireotide. Okay. If there is any recurrence after surgery, then we will treat with pegvisomant. Pegvisomant is growth hormone receptor antagonist. Pegvisomant is growth hormone receptor antagonist. Ant means antagonist here. G for growth hormone receptor.